A virus, deaths, and authorities rushing into action. Sounds familiar, doesn't it? But no, it's not the coronavirus. It's the Nipah virus this time around that has created the latest health scare. After 5 cases were reported in Kerala, the state government and the centre swung into action. The Kerala Health Minister, Veena George, held a high-level meeting to review the situation in Kozhikode, where the cases were detected. Now, 2 of those 5 infected people have died. Listen in to the latest development in Kerala.
So far, 3 samples are tested Nipah positive, and yesterday morning onwards, we have started contact tracing and categorizing the contacts, and we have a good protocol which was drafted in 2021 and which was issued by the health department. And as per the protocol, we have formulated 19 core committees, and all the 19 committees are in place from yesterday early morning onwards.
Now, that was the state government, but remember, the central government has also rushed a team of experts to the state. The state's health minister, Veena George, whom you listen to right now, has also said that the virus strain that was seen in Kerala is from Bangladesh, and it's the Bangladesh variant of Nipah. Now, surveillance, contact tracing, isolation facilities, containment zones, all measures are being taken currently, and the medical fraternity as well as the authorities are trying to prevent another pandemic-like situation. But let's first understand what the Nipah virus is. It's a zoonotic disease, which basically means that it is transmitted to humans through infected animals or contaminated food. It can also be transmitted directly from person to person. The animal host for this virus is known to be the fruit bat, which is also commonly called the flying fox. Now, fruit bats are known to transmit this virus to other animals like pigs, dogs, cats, goats, horses, and sheep. In terms of geography, the Southeast Asia and Western Pacific regions are places which see this virus extensively. It was first identified during an outbreak in Malaysia back in 1998, and all subsequent outbreaks have occurred in parts of Asia, in India, Bangladesh, Malaysia, and Singapore. Symptoms. Talking about symptoms, they typically appear in 4 to 14 days, and they include symptoms like fever, headache, cough, sore throat, difficulty in breathing, vomiting. These are the initial common symptoms, but they can turn into severe symptoms as well, such as disorientation, drowsiness or confusion, seizures, coma, and brain swelling. Now, currently, there are no licensed treatments for Nipah virus, so doctors are still relying on precautions like avoiding contact with animals or infected people and social distancing. The Nipah virus, remember, spreads slower than the coronavirus, but it is far more lethal. And that is exactly what makes it a huge concern and a big silent killer. How bad is this situation right now in Kerala? Should we be alarmed by these cases in the state? Will they spread to the entire country? And what should you do if you or someone you know does in fact get infected by the Nipah virus? Our panel of experts today will clarify all of these questions for you. But first, let me go straight across to the man who identified this virus yet again in the state of Kerala and alerted the authorities. I'm joined on Beyond the Headline by Dr. A.S. Anup Kumar, Director Critical Care, Aster, in North Kerala Cluster. Dr. Anup, good evening. Thank you very much for speaking with Mirror Now. You're somebody who has been instrumental in identifying the Nipah virus, not just this time around, but back in 2018 as well, when it first entered India and the outbreak was seen in Kerala. First of all, help us understand what, how did you detect the Nipah virus? What did you see in the patients? And when was it identified in Kerala?
In 2018 outbreak, we identified the Nipah for the first time. That time we had a cluster of patients coming from a same family with encephalitic symptoms. But they were having some unusual symptoms than the normal encephalitis we usually encounter in the ICUs or in the emergency department. And in that family, there was a death which occurred almost 2 weeks before, and he was also having unusual symptoms. So, like an index case, then a clustering happening, then the unusual symptoms. These made us to think about some unknown viruses. Then on detailed history, like they were having like contact with they were like staying near a forest where there were many bats. So that made us made us to think about the possibility of Nipah, and the samples were sent, and we were able to identify for the first time. But this time the situation was entirely different. But again, there were a few similarities. Like one patient was dying in another hospital in Calicut with bronchopneumonia, then later on going into multi-organ failure. But after almost 10 days, so the first patient died on 30th of last month, but on 10th of this month, to the hospital where I am working, four patients admitted from the same family, three children and one adult with fever and cough. So they were mainly having respiratory symptoms alone. So they were having mainly the respiratory symptoms alone. And again, in those group of patients as well, there was a few unusual symptoms. Like the first patient had the slurring of speech, diplopia, etc. And the present patient who were admitted, like one of those patients, developed a seizure along with the features of bronchopneumonia. And these patients were coming from the same epicenter where the initial cases were reported in 2018. So again, an index patient, clustering in the same family, some like doubtful symptoms, and the location wise from the near epicenter. That made us to think about the possibility of Nipah. We have informed the health authorities immediately and sent the samples after the initial screening from our hospital itself. So again, within a very short time span, we were able to identify and able to isolate the patients. And as we have informed the health department and the state government, they were also very active in all the preventive measures. The health minister immediately reached the city here in Calicut and arranged all the preventive measures like the contact tracing, and all other the measures to prevent this outbreak.
Okay, Dr. Anup Kumar, what's the situation like currently in Kerala? Should we be worried that it might turn into a pandemic-like situation, the kind that we saw during COVID-19, or is it going to be different? Has it been contained at a very critical stage?
It is very unlikely to happen a pandemic with Nipah, because we have the history of many previous outbreaks. There were almost 650 cases reported before from 1998 to 2023. So in all those small outbreaks in different countries, the outbreaks will usually settle by its own. The usual nature of Nipah virus is when the transmission occurs from one person to the other, the transmission chances are coming down, and again it will not spread from the second person to third person, and it will not multiply like that, or the transmission rates will come down as the disease getting transmitted from one person to the other. So it is very unlikely to make a pandemic, and usually these outbreaks will get self-contained. That is what we have experienced in last three outbreaks in Kerala, and other experience from other areas as well. So we don't have to worry about any pandemic. And right now also in Kerala, the situation are fully under control. We have all identified all the contacts of the patients like from whom we have diagnosed the Nipah, and all those the identified contacts are quarantined, and they are all under close monitoring whether they are developing symptoms. And we have made all arrangements to test for the Nipah when they are developing early symptoms, and to provide the best treatment possible.
Okay, Dr. Kumar, you said that cluster infections is what alerted you. A family had been, infected with the Nipah virus, and there was the father and the two children. So clearly that means that this is not restricted to any age group. It can infect anybody, and everybody is vulnerable when it comes to the Nipah virus. Does it also mean that the symptoms are also going to be same in all age groups, or it's going to be more in vulnerable groups such as children and the elderly and the ones with comorbidities, or is it going to be similar for all ages?
Yeah, with our previous experience and again the previous data, the symptoms will be almost similar in all the age groups, and all the age groups are prone to develop symptoms also. And we don't have enough data to say that the vulnerable people, when they are getting infected, like in case of COVID, they are having the mortality chances in them are high. We don't have any evidence right now to say like that.
Okay, my last question to you, Dr. Kumar. We've seen Kerala being at, an unfortunate point where it does get a lot of these new viruses that come in. We saw that with coronavirus. We are also now seeing it with the Nipah virus. What makes Kerala so vulnerable as a region, geographically or otherwise? You might be knowing better. That we see the cases, some of the initial cases in Kerala first?
No, I don't think that statement is correct, and I don't think the Kerala is more vulnerable. It is because our health system is so much advanced,
Okay.
where we can suspect and identify the cases so quickly. So that has happened in COVID time also. We were able to identify from the first case itself, the previous Nipah outbreaks, the Zika virus, and again the Kesanur forest disease. All those viral outbreaks were picked up from the initial cases itself. So that is why more viral cases are getting reported. This time also, like as I've already told, a person was coming with the features of pneumonia, and a few of the contacts were developing pneumonia again. So even with such a unusual presentation of Nipah, we were able to identify from the second group of patients itself. In 2018 outbreak also the same thing was happening. Before that, everywhere, even in the Singapore, the country which is having an excellent healthcare system, even they were not able to identify the outbreak in few weeks or even months. So after the many persons died, then only they were able to identify that was a Nipah outbreak. But in Kerala, like all the time, this is the fourth time we are getting the Nipah outbreaks. So every time we were able to pick it up from the first case or from the second case itself. So that is why we are getting more viral outbreaks in Kerala. It is not because the incidences are more. It is because we have an excellent healthcare system where we can identify and isolate these cases very effectively.
All right, all right. Thank you very much, Dr. A.S. Anup Kumar, for talking with Mirror Now. Of course, all of you in Kerala, please do take care of yourselves as this new health concern does come up. But thank you very much, Dr. Kumar, for joining us on Mirror Now and helping us understand how this Nipah virus really is developing in the state of Kerala. With that, let me also go across to my other guests tonight. Dr. Ishwar Gilada, Secretary General of the Organized Medicine Academic Guild, joins us. Dr. Rajiv Jayadevan, Co-Chairperson, National IMA COVID Task Force, joins us. And Dr. Subramanian Swaminathan, Director, Gleneagles Global Hospitals, also joins us tonight. Good evening. Welcome, gentlemen. Thank you very much for talking with Mirror Now. Dr. Gilada, to you first. We just heard Dr. Anup Kumar tell us how this is not going to turn into a pandemic and there's no reason to panic. And perhaps, adequate measures now have been taken in the state of Kerala to curb the spread of this. How do you see this really moving forward now that measures have been taken? And what do you think is, should we be on high alert? Should we be concerned about the Nipah virus entering the country and cases being identified and unfortunately deaths also happening?
At the outset, I would like to have a big salute to Dr. Anup Kumar for his clinical acumen in 2018 and now. Secondly, the transparency and honesty of the Kerala government to come out So often it is said that Kerala is the originator of the problem. No, they are able to identify the problem. Secondly, if you look at the trajectory of or the pandemic or is not pandemic or outbreaks of Nipah virus, never ever it became endemic or pandemic because it has a self-limiting disorder. People die. Often, if we look at medical angle, we think that it's a very high mortality. But if you look at public health angle, those infections which are having high mortality but doesn't spread beyond after the containment zone, they are better than those having less mortality but spread become a wildfire. So looking at that, we have never seen any kind of epidemic or pandemic of Nipah anywhere in the world. It has been contained to 4 or 5 or restricted to 4 or 5 countries in the world. Secondly, only those areas, for example, in 2018, the places 10 kilometers from the current villages, they got the infection. So the best strategy is to have a containment zone, and that's what is government of Kerala doing. By doing that, you don't allow the infection to go out of that particular territory, and then you can contain. Currently, there is no treatment available. There are a couple of treatments being tried. One of them is a monoclonal antibody, which is M102.4, that has been successful in phase 1, but it has not gone to phase 2 or phase 3. And other antivirals like remdesivir or sodopavir, they have been tried, but they have been tried in non-human primates. So in that situation, if there is no treatment, if there is no vaccine, the only thing is containment. And for others who are nearby or in the vicinity or in medical care profession where they are caring these people, they must follow SMS, social distancing, masking, and sanitizer. And that has been very nicely taught to us during the COVID pandemic.
Yeah, but perhaps, unfortunately, we've all gone complacent and we've forgotten that COVID-appropriate behavior that we all followed during the COVID-19 pandemic. And we, of course, now have to get it back at all times, whether we have a health scare or not. Dr. Rajiv Jayadevan, coming to you, you've been part of the IMA COVID task force. And, some of the initial symptoms of the Nipah virus include sore throat, coughing, headache, all of these, fever. All of these symptoms are also very similar to what we saw during COVID and what we see during the common flu that we all get time and again. How do we differentiate between the Nipah virus symptoms and whether it's just common flu or COVID?
In medical school, the MBBS student is taught how to discern between symptoms. And a common example we use when we teach students is when you hear hoofbeats outside your window, you think of a horse and not a zebra. Now, I don't have to explain why that is, because a horse is a lot more common than a zebra. Likewise, when you have all of these symptoms that you mentioned, it's quite likely that the person has an ordinary viral fever, what we call ordinary, which is not specific, or it could be something a little bit more specific, like influenza or even COVID. Right now, India is not having a lot of COVID at this point. But in the right setting, suppose you go to a zoo and you hear hoofbeats outside your window, which is outside your zebra pen. Yes, it could well be a zebra, right? Likewise, if you live in an area that has seen Nipah cases before, and the doctors and other healthcare system in that area are geared towards diagnosing it, yes, if similar symptoms come with a clinically compatible scenario, yes, that is when you start thinking at least of Nipah, not as the first diagnosis, but perhaps a second or third possibility. And that's typically how most diagnoses are made in clinical practice. So it's not as though the patient with Nipah will come to you with a label saying Nipah on their chest. It doesn't work like that. So it's incredibly difficult actually to sort out or to fish out these Nipah cases from a very large population of patients with fever. As you know, fever is a quite common problem. And so we heard Dr. Anup Kumar and his work and his team effort and that have consistently produced diagnosis. Now, about diagnosing it, it's occurred in Kerala, it's occurred in West Bengal, it's occurred in Bangladesh quite commonly and in other East Asian countries. Now, the point here is for our audience to understand there's something called the R0. That's a basic reproduction number. Basically means the ability of a person, an infected person, to infect other people. Say for COVID, it is 2 to 3, which means if I got COVID, on average, I could spread it to 3 people. But for Nipah, it is consistently below 1, sometimes somewhere between 0.3 to 0.4, which means one person will infect 0.4 people, which is below 1, and that person will infect 0.4 people, which means eventually the cases will die down. And that's typically what we see around the world when all the outbreaks have died down in the locality itself without spreading to faraway areas. So it has no pandemic potential. But if you are infected with Nipah virus and you're symptomatic, you know what? It is not good news for you because A, we don't have a recommended antiviral treatment, and the mortality rate, unfortunately, is quite high. It can range anywhere between 70, even 90%. So that is the importance of tracking these patients down, tracking their contacts, making sure they don't spread to other people.
Yeah, Dr. Subramanian Swaminathan, if there is no proper solid treatment yet for the Nipah virus, we don't have any particular medicine that is working out for it to cure it. What's the solution? How do we go about it? If we get infected with the Nipah virus, what's the first step that we should do?
It being Nipah, like Dr. Rajiv just mentioned, is actually quite low. Remember that it's actually very difficult to contract Nipah, even if you're in the endemic zone, simply because the probability of it being an unrelated fever is actually quite high. So first thing we need to do is reduce panic, because there's still a lot of dengue, malaria, and influenza, and all the other things going around. So let's not panic that every fever is Nipah. That's number one. Number two, seek care. Do not run away. The idea is not to create panic and to spread to other places. Yes, the probability of it spreading is very low, but it makes sense for you to stay put where you are and seek care with people who know what they are doing. It doesn't mean all of us should be crowding Dr. Anoop's OP tomorrow morning. That's just a very absurd way of doing things. But it's important to self-quarantine, and if more symptoms start coming up, go to a place where they know what to do. Because these places would have the skills to triage them and try and identify who's likely to have Nipah and who's not likely to have Nipah. The third thing is obviously upscaling diagnostics. So obviously this is the time frame where we start getting, try and see if we can move the PCR tests or whatever we can to the front end and see if we can quickly start triaging the people who could be possibly infected and then start isolating them. Now, supportive care is the best option as of right now. The specific antiviral and the monoclonal, as has been very clearly mentioned, the potential for it is there, but as of right now, there is no data. The answer is let's not do more harm than good. And in a misguided attempt to help a patient, we should not end up hurting them. In COVID, we've made mistakes like that, whether it is HCQS or ivermectin or whatever it is. There have been some misguided attempts to help patients, and it's not ended well. And animal data cannot be extrapolated to humans because there's a lot of difference between us and a mouse and a rat and a fox or a bunny rabbit. So we obviously have to have a good phase 1, phase 2, and hopefully even phase 3 data. So I think for us to start reaching out to all of these things is more desperation-based medicine rather than scientific medicine. And it only is a scientific misadventure rather than true care of the patient. So at this point, at least, the best thing to do is to try and see how we can contain it and provide the best level of care that we can at this time. Obviously, there are some compassionate use options which are being touted. Now, this needs to be studied by a high-level team. The data needs to be looked at, probably get the original data set from the concerned authorities and see if it makes sense. And in the setting that it does make sense, then we need to have a conversation scientifically, not in the public domain, scientifically, to see if this is something we should invest in. But all of this needs to be done on a scientific basis, and it cannot be due to panic or fear or, you know, as a scientific adventure.
Yeah, absolutely. Dr. Gilada, you know, we talked about how Kerala has a robust testing system and therefore it is able to detect these viruses and diseases much earlier than other states across the country. But does that also point to the fact that other states might be having these cases of Nipah virus? And if yes, then what's the way to go about it, number one? And number two, the Kerala Health Minister has stated that this is the variant that we are seeing of the Nipah virus currently is the Bangladesh variant. Does that also mean that the states near Bangladesh and between Bangladesh and Kerala might be having more such cases?
See, we cannot say that other states will be having more such cases. But at the same time, we should have a surveillance. And surveillance means if we understand what are the symptoms like, are there three things which are commonly seen? That is clustering, whether it's an index case, you are able to find out if you get one case and you are able to find out from where they got an unusual symptom. For example, in such cases where you have a respiratory system involved, along with that you are getting a brain also involved. So such kind of unusual cases. But at the same time, if you're talking about Bangladesh strain, there could be also similar strain in West Bengal, because in West Bengal we had 2 or 3 places where it was there earlier, in Siliguri and in Nadia district. So we actually what happened, whenever new such problem come, we go through the other parallel phases of denial, blaming others, then recognition of the problem, then planning. So we should not do any kind of denial and blaming others. We should not call it Bangladesh variant or this variant. It is there in Kerala. It is there in the same area where it was there in 2018. Maybe that variant also was a Bangladesh variant. So I think we shouldn't get into that. We should just look at what can be done and how fast we can do a research on that. Because this is from a paramyxoviridity family, from where we have other infections like measles, mumps, as well as RSV virus, that is respiratory syncytial virus, para-influenza virus. So at least 4 other viruses are there already from the same family. So if something can work on those things, probably it can work on this also. For example, during monkeypox, we have seen that smallpox vaccine help in monkeypox because they belong to the same family. So I think we should make a good research out of it. We should collaborate with 4 or 5 countries where they had such kind of issues, and we should keep up open surveillance and do also genome sequencing to understand how far it could have gone inside.
Yeah. Okay, Dr. Rajeev Jayadevan, last question to you. During the COVID-19 years and in the post-pandemic era, we've learned our lessons during the pandemic, the world over, and here in India as well. We've built and strengthened our health infrastructure throughout the country. With the Nipah virus now being detected, do we have the adequate and proper arrangement and infrastructure in place? And what's the kind of requirement that one would need with this? Would it be different from what we have seen earlier during the COVID years?
That's an excellent question. One of the positives, if you will, that came out of the COVID pandemic is exactly what you said. There is first and foremost, there must be a chain of command which must be followed. There must be well-established protocols which encompass all of the possibilities with minimum repetition, minimum redundancy, and optimal use of infrastructure and the economical use of resources, including testing as well as hospital facilities, which are limited. Now, India has shown the world that we did far better than we were initially expected to do, considering the intensity of the COVID pandemic. Now, coming to Nipah, at this point, from a scientific standpoint, I'll summarize it into 4 objectives. The first and foremost is to treat the current patients with the maximum care and also comfort their families, who will be terrified of whatever they're seeing and hearing about it on the news. Second will be to stop any further spread of this virus from any of their contacts who are classified as high risk or low risk, depending on the intensity of exposure. The third and the most important from a scientific standpoint is to find out how the virus jumped from this bat on to the first patient. You know what? Until now, that mystery has not been solved in spite of multiple outbreaks in multiple countries over the past 20 years or so. We need to find out what it is that creates the situation where the virus living peacefully in one species, that is a fruit bat, jumps onto a human being, creating death and devastation. So that question has to be answered. People claim that it might be from eating raw fruit or half-eaten fruit, half-bitten fruit lying on the ground. You know, that's a convenience theory. There's no proof for that. There could be other methods. For instance, there are secretions on the bat Their reproductive fluids could be falling on the ground. Their excreta could be falling on the ground, and they could be carrying virus, which could enter the human body in more ways than one. And lastly is communication. What India taught the rest of the world during the pandemic was excellent communication, direct to the general public, saying, these are the facts. Like Dr. Swaminathan said, you know what? There were so many fake treatments that were peddled all around the world, but India, we managed to stay reasonably scientific given our limitations. So we must communicate effectively. The first point I would communicate is, don't be afraid of eating fruits. That's number one. Number two, don't go and catch bats. Many people think, let's go and kill all the bats. No, that's a blunder, because we do not want to get exposed to a dead bat or even a half-dead one, because that could lead to a scenario where more viruses could jump from these animals onto human beings. So staying scientific, clear communication, avoiding unnecessary panic is the way to go.
And not believing rumors, and of course sticking to the COVID-appropriate behavior that we were following all these years. Whether there is a Nipah virus detection or not, we all need to follow those guidelines. On that note, I'm going to wrap this discussion up. Dr. Gilada, Dr. Jayadevan and Dr. Swaminathan, thank you very much, gentlemen, for talking with Mirror Now and helping us understand this new health scare of the Nipah virus that has now been detected in Kerala.